Welcome to part 10 of the Iron Chronicles, documenting the role of iron in the diabetic state as well as other chronic inflammatory conditions. We'll begin with iron overload's role in affecting the endocrine system, or the glands and organs releasing hormones. Hypogonadism and hypothyroidism have been correlated with patients with hemochromatosis. It was initially thought that hypogonadism appeared to be a primary symptom, with thyroid dysfunctioning developing downstream of other affected tissues. Hemochromatosis patients frequently experience low libido, infertility, hair loss, and low testosterone. However, it has been found that in patients experiencing advanced hemochromatosis, it is possible for the pituitary gland at the base of the brain to become overloaded with iron as well. Yet because the pituitary, otherwise known as the master gland because of its direct ties to the thyroid, the gonads, both the ovaries and the testes, the adrenals and kidneys, it has led researchers to postulate that thyroid, gonadal, adrenal, and renal dysfunction occur as a secondary symptom of an iron-overloaded pituitary gland. This would lead one to believe that those taking thyroid medications, experiencing hormone imbalances, and adrenal fatigue need to be aware of their iron status. Iron continues to extend its reach beyond the visceral organs into our skeleton. Iron overload is implicated in the development of a number of bone and joint disorders, including osteoarthritis, carpal tunnel, cartilage degradation, joint inflammation, and synovitis. The research suggests that the resulting inflammation caused by iron overload facilitates programmed cell death of chondrocytes, which control the formation of cartilage, and promotes the expression of tissue-degrading enzymes. And this makes sense. Bones, marrow, and the formation of structural tissues is intimately related with iron recycling. Bone marrow is where red blood cells, the main carrier of iron in our body, are created. When chondrocytes are operating correctly, they elicit an increase in iron metabolizing proteins. So might bone cells be getting overloaded with iron, oxidizing, and then calcifying? Research has shown that in states of excess iron, bone cells undergo a decrease in extracellular matrix and a compromised ability to create new bone cells, leading to osteoarthritis. Therefore, iron is affecting bone and tissue integrity and their ability to regenerate. For those experiencing osteoporosis, arthritis, cartilage issues, chronic joint pain, and improper bone and tissue growth, look at your iron load. Heart disease is at the forefront of the American health crisis. It claims over 700,000 lives each year. Heart disease includes conditions like atherosclerosis, arrhythmias, congestive heart failure, cardiomyopathy, and ischemic attack. The connection between hemochromatosis and other iron-altering disorders and heart complications is well documented. A condition called beta thalassemia that affects your body's production of red blood cells and thus your utilization of iron has a history of heart failures. Hemochromatosis patients experiencing different degrees of cardiac issues depending on the severity of their condition. Approximately 1/3 of hemochromatosis patients die of cardiac causes. Might iron be a uniting factor in all of the accepted risk factors for developing heart disease as well, such as poor diet, weight gain, and diabetes? Although the gut has taken center stage in many of today's health conditions, few people know that iron content in the gut has a direct impact on its flora. Seemingly, the fewer strains of bacteria in your gut, the worse off your health is. There aren't necessarily good and bad strains of bacteria, simply a disruption to our harmonious balance. Many of the probiotics advertised in all commercial yogurts, kombuchas, and other digestion-supporting products seem to focus on a few key strains of beneficial bacteria. Different strains of lactobacilli and bifidobacteria are by far the most common in many commercial fermented products. E. coli and proteobacteria are those implicated in the causation of dysbiosis, which leads to irritable bowel syndrome and Crohn's disease. Several research studies have looked at the effect of oral iron intake and the resulting gut flora changes. It was found in those that were supplementing iron, lactobacilli and bifidobacteria are greatly reduced, while pathogenic bacteria like E. coli and Bacteroides continue to flourish. Each study noted increases in pathogenic species and decreases in healthy species, all leading to elevated markers for inflammation. Iron availability in the colon lumen is a critical signal for the expression of virulent genes by pathogens and hosts. Conversely, decreasing the iron content within the gut has led to improved gut flora. The implications of these findings are wide-reaching. Consider all of the gut-body ties being outlined currently with obesity, Alzheimer's, diabetes, and psychological disorders. Have any of the health professionals within their respective fields thought to look for iron in the gut?